Hello, welcome to Advanced Rehabilitation Services. My name is Maria Duran and I am a board-certified occupational therapist. Today we will be talking about the topic of liposuction and how it affects the lymphatic system. Liposuction is a very common surgical procedure that is used to remove unwanted fat and contour the body. Although it can be beneficial to increase mobility and reduce all of these side effects caused by obesity, it can also have an impact in the lymphatic system. The lymphatic system is a network of vessels, tissue, and organs that work together to transport lymphatic fluid that carries infection-fighting white blood cells throughout the body. The lymphatic system plays a very important role in the absorption of fats from the digestive tract system, maintaining fluid balance throughout the body, as well as fighting infections. Now that we have a snapshot of what liposuction is and its purpose and how the lymphatic system works, we're going to talk about how liposuction impacts the lymphatic system. Physical disruption. While liposuction is performed, it can cause some damage to the lymphatic system, more specifically the lymphatic vessels. And this can cause some swelling in the area as the lymphatic flow may be disrupted. Although the body tends to heal from these type of trauma, it may lead to some long-term swelling in the targeted area. Inflammation. The process of liposuction can cause inflammation in the targeted areas, which causes, again, a disruption in the lymphatic vessels and the lymphatic flow. Although the body itself tends to heal and reabsorbs all that inflammation and decreases it as time progresses, in some cases it can become chronic, especially if post-operative care is not followed. Lymphatic function and fluid balance. Usually post-operation, the body will tend to retain water as the lymphatic vessels have been disrupted. In the cases of liposuction, clients are required to wear compression garments to ease the inflammation and swelling, as well as support the lymphatic system as it's trying to heal. Scar tissue formation. Scar is going to form as the body starts to heal. It's a natural way for the body to start closing any wounds, whether we see them or we don't. And what happens is these process can cause a disruption, again, in the vessels of the lymphatic system. Therefore, the use of manual lymph drainage can be very helpful to break up the scarring as well as promote lymphatic flow in the affected areas by liposuction. There are some long-term considerations that a client has to take in order to be able to understand the process of liposuction. Although we all look at how wonderful it looks long-term, we also have to understand that there might be issues that may come with the process of going through this type of surgery, such as increased inflammation, as mentioned before, scar tissue formation that may disrupt the area by causing fluid to stagger, poor wound healing. It's another issue that may be disruptive in this whole process, especially if a client has other medical conditions such as diabetes. A wound may not heal as well or as quickly as desired. Infections. Infections can be very common in this type of procedures, especially if there is no follow-through with instructions of how to care for the open wounds or for the surgical incisions. So how can we promote a quick and good recovery post liposuction. Number one, the pre-assessment. Pre-assessment basically is when the doctor meets you for the first time and takes a good look at your medical history and how the approach will have to be, and explains to you all the processes that will go through with the liposuction. That's the first step. The second step is the surgical procedure. There are many types of liposuction, and for different reasons besides beauty. We understand that there might be liposuction also for people who suffer from lymphedema. Therefore, the type of liposuction tools might be different, as well as the procedures. So that the least invasive procedure will definitely provide the least amount of headaches, for lack of a better word, post-surgical. The post-operative care. Very important to follow up with all of your appointments, including your physician's appointment, making sure you wear your garments as required by your physician, as well as following through with lymphatic management, such as manual lymph drainage post-surgically, can help heal faster and with better outcomes. Monitoring your health. Very important for you to be aware of your diet, your ability to be mobile after surgery. Increases your ability to heal better, faster, as well your diet. You can't just decide that now that you had liposuction, you will not take care of yourself. This is a very serious surgical intervention. Therefore, you have to be responsible for what you eat, how you exercise, how you move, your garment, and taking in your hands the ability to make the decision of following through, like I mentioned before, with your doctor's, therapist appointments as well. In conclusion, liposuction is a great way to remove fat from the body for either contouring reasons as well as health reasons. However, there is an impact that can cause in the lymphatic system. Therefore, it is our responsibility as the patient to make sure that we follow through with all the instructions provided by our physicians, therapists, as well as our diet and exercise that might be included to help heal this procedure faster and better. I hope you enjoy this information. If you like this information, please subscribe and share with others. And I look forward to working with you on your path to better health.